we're going to look at leprosy and the classification, that is Ripley Jopling Classification. So under this, there's TT, that is tuberculoid leprosy. Looking at the number of lesions, there are 1 to 3 well defined and it is hypopigmented. The hypopigmented macules or plaques. And other keyword to know is it is saucer right side up lesion, and the distribution, it is asymmetrical. Next, looking at the size, it is usually large, and the surface of lesion is dry, scaly and infiltrated. Sensations are usually absent. Looking at peripheral nerves, in peripheral nerves it is asymmetrical, single nerve enlargement. Looking at the hair, it is usually absent, and under bacteriology of hair it is absent, and in bacteriology of split screen smear it is negative. Looking at the lepra reaction, it is 1 lepra reaction. Lepromin activity, it is strongly positive. Lepromin reactivity, strongly positive. Histopathology, it is dermal tuberculoid granulomas, and there is no bacilli seen. Now moving ahead with the next, that is borderline tuberculoid, BT. Borderline tuberculoid, it has hypopigmented macules and plaques. The number is up to 10, and it has finger-like extensions known as pseudopodia. It's also known as satellite lesions. And looking at the size, it is variable and mainly large, or can be variable as well. And the skin surface, it is dry, scaly and infiltrated, but it is less compared to the tuberculoid leprosy. Looking at the sensations, it is diminished slightly. The peripheral nerves, it is asymmetrical and enlargement of few nerves. Looking at hair, it is diminished. Bacteriology on split skin smear, it is negative, or there is scanty bacilli. Looking at the lepra reaction, it is type 1. Next, moving on to the lepromin reactivity. It is weakly positive, and on histopath examination, what is seen is fewer tuberculoid granulomas and there is presence of a Grenz clear zone in the upper papillary dermis, and the nerves are replaced by granulomas, and there is fragmented bacilli. They are seen in the AFB stain. Next, moving on to the third level of classification, that is the BB. It's nothing but the borderline. It has hypopigmented macules and plaques, and another key term is Swiss cheese or inverted saucer or punched out appearance seen, and the number is usually 10 to 30. The size is totally variable size, and looking at the surface of the lesions, it is dry, scaly, and slightly skinny. Next, looking at the sensations, it is also diminished, and the involvement of nerves, a symmetrical involvement of several nerves. Next, looking at the hair, it is diminished, and the bacteriology of split screen smear, it is moderate number in case of the AFB present, and the typical lepra reaction is type 1 and 2 are present. Then looking at the lepromin reactivity, it is negative or weakly positive, and histopathology, presence of tuberculoid granulomas, they are less prominent. There is Gren zone, it is more prominent, and there is also a transverse section of nerve, it shows cut onion appearance. Next, the other classification heading is BL, that is borderline lepromatous. Under borderline lepromatous, there is numerous hypopigmented. These are macules, plaques, papules, and the keyword is again the Swiss cheese. It's inverted saucer, punched out appearance, and it is symmetrical in distribution. Looking at this size, it is small, and the surface, it is shiny, it is diminished sensations. The nerves, peripheral nerves, it is increasingly symmetrical enlarged nerves. Looking at the hair, it is slightly diminished, and the bacteriology on split screen smear, it is a moderate number of AFB, that is present. Then the Lepromyn reaction is either type 1 or type 2, and the Lepromyn reactivity, it is negative. And moving ahead with the histopathology findings, under histopathology there is prominent foam cells that are present. There's prominent Gren zone that is present. The nerves show concentric nerves. If you see, they show concentric perineural cell infiltration, and there is more conspicuous cut onion appearance. This cut onion appearance as well. Looking at the AFP are plentiful, including the AFB. They are plentiful, including small globi. Looking at the last heading under the Ripley Jopling classification is LL. That is nothing but the lepromatous leprosy. Under lepromatous leprosy, it's hypopigmented macule papule plaques nodular lesions, and there's innumerable lesions, and it's perfect symmetrical distribution is seen, and the size of the lesion, it is small, and appearance wise it's shiny, and looking at the sensation, it may be normal. The ulnar nerves, peripheral nerves, it is glove stocking, anesthesia, that is a key term to be seen. Nerves may feel normal, so they feel nerves, they are normal on palpation and may be thickened as well. Other thing to note is the hair, it is almost normal, and under the bacteriology on split screen smear, it is plenty of AFB, including the globi. Now looking at the Lepromyn reaction, the Lepromyn reaction is type 2, and in case of the Lepromyn reactivity, it is negative. Next, looking at the histopathological aspect, there are prominent foam cells, there's prominent Gren zone, and the nerves, it shows concentric perineural cell infiltrate, and more conspicuous cut onion appearance. Onion appearance. And what is seen is the AFP. They are plentiful, including small globi. Thank you.